Correct. Okay. Yeah, so for if there's any new student outsiders over here, they are first time attending my class. Hello, my name is Davin. Okay. So we'll be mainly doing Form 4 Chapter 12. Now, actually, every year punya the our midterm seminar, right? Actually, every year also I do Form 5 Chapter 1. And I realized Chapter 1 pretty boring. Chapter 1 also quite easy. And since we only did that recently, right? So I change strategy a bit. I do Form 4 because actually in our entire bio, right, the last few chapters of our Form 4, especially chapter 10 all the way to 15, right, is the hardest part. That's why last year your punya final exam, right, quite a lot of you didn't score very well. Okay, it's normal one. Because those topics that you did are actually the hardest in bio. Okay? You new student, okay. Later I come and touch you a bit, new student. Okay, just kidding. Okay, come. So, for Form 5 Chapter 1, right? Okay, if you want to watch my videos for revision, right? Okay, actually, if you go to my YouTube, right, the past few years punya midterm seminar recording, right, actually it's all Form 5 Chapter 1. You watch 2025 one, 2024 one, all is actually Chapter 1. Okay, now if you don't want to watch the whole seminar video, right? Okay, last year I got do state trial series for last year punya SPM student. You come to my YouTube, come to this playlist over here. Yeah, I think I told you all before already. There's Form 5 Chapter 1 here, which actually I did last year punya trial questions. Okay. If you want to watch like the 2 hour last year punya recording is here lah, 2025 midterm seminar. 2024 also got, but I don't know where is it. I didn't create a playlist for that lah. Okay. So today we mainly focus on Form 4 Chapter 12. All chapters got don't have all chapter lah. Okay, I don't have time to do all lah. Then I also a bit lazy lah. Okay, so but recently you can see my YouTube got quite a lot of videos. We go to exam already. I got a bit Form 4, but those easy chapters lah. Yeah. So we do Form 4 chapter 12 today. Okay, now this chapter actually last year punya SPM got a lot of trial paper come of chapter 12 because last year one of the hottest topic for SPM actually was this one. So your school exam might use a few of those trial paper for your upcoming exams. So therefore, maybe you can expect some of it in your exam lah. Okay. So the things that you're going to do for Form 4 Chapter 12, right? Number one, you can see the picture here already. You're going to do neurons. Okay, so how to compare the neurons? We have the relay motor, what else? Relay motor sensory neuron. Other than neurons, we'll be doing synapse. If you forgot what is synapse, synapse is the gap between two neurons. Okay, so and they quite like to ask, right, how different drugs affect the transmission of nerve impulse across synapse. You know your what, stimulant drug and depressant drug. Depressant. And then what else you have we will do today is also I can't remember it. Oh yeah, the diseases related to your nervous system, you know, the Parkinson, Alzheimer, and also the voluntary, involuntary action, that one, comparison, you know what, the reflex action. Yeah. So the question that I don't have here is the hormone question. You know what, thyroxine, growth hormone, insulin, that one. So hormone, this one, I will maybe do a bit of recap towards the end of the class lah. Okay, but mainly we will cover this. So their structure and so essay questions, we will target both lah. And the essay question you see here, right, are actually all last year punya trial paper. So they are literally exam types of question. Okay, so yes, by the way, we are at page 54. We straight away do chapter 12 punya question lah. Form 4 one harder a bit now, so we do the harder one lah. Ready? Wait, let's go. Now, if your friends haven't come, faster ask them come. So these two neurons, Q and P, still remember which is which one or not? Okay, I ask you first. Sensory neuron. Okay, the neuron that help us sense stimuli is P or Q. P or Q is sensory. Test you see how many of you still remember this. Is okay, the answer is Q. Why got P one here? Okay, so this is, okay, just kidding, sensory neuron. Okay, so if you got new student, if you answer wrong, I won't scold you and I'll laugh at you only. So no. Okay, so anyways, sensory neuron, right? Look at the cell, this thing called the cell body. It's always like bulging in the middle one. I got a tumor like that one. Okay, and this one, the cell body at the head there one, like what, at one end one, that's your motor neuron. Now, usually they won't ask you to compare relay neuron lah, because relay will look completely different. Relay is just like one, like that only one. Okay, so very easy to recognize. Nothing much they will ask about it. So, sensory and motor. Okay, so sensory neuron is basically the neuron that transmit nerve impulse from your, you call that, receptor. Sorry, suddenly forget the word. Receptor to your central nervous system, means your spinal cord and brain. Like I told you before so many times, if somebody hit you, your sensory neuron transmit nerve impulse to your central nervous system, whereby inside your spinal cord and brain, you have the relay neuron. So they relay the message to your brain, and then you think, okay, I want to touch him back. Then from here, you will transmit nerve impulse back into your spinal cord. Then it will connect to motor. So motor will transmit nerve impulse from here, spinal cord and brain, to your effector to help you respond. So the meaning of motor in bio means respond. Okay, so I write down I write down the function for you later. So why not we try to compare these two? Okay, which I know there's no question here asking us to compare, but let's do a quick practice. Yeah, they will ask us to compare these two neurons on sometimes, most of the time. So number one, the easiest one, look at the cell body. So cell body punya position. So number one, okay, write at the side here, or you want to write on a piece of paper also can. So cell body is located or found at the middle of the neuron. Cell body in the middle. Number two, this one, we will say cell body is at the other end ma. So we will say is located at the terminal. So we don't say at the end of the neuron. We use this word called terminal. Terminal means at the end lah. Okay. Now, there's another thing that you can talk about the cell body also. Another thing that's different about the cell body is the position or the location of the cell body in your spinal cord. Okay, let me see how many of you remember this. So in your spinal cord, right, where do we find exactly these two cell body? Hey, I see somebody got correct already. Okay. Gray matter and also the dorsal root ganglion. Okay, correct. Yes, Hazim and Isaac. So each of you mentioned one of the correct part. Okay, later we will do this spinal cord question. So if you forget already, it's okay. Later we will do this. I know you all should forget one. So, okay, how your these two neuron, right? One is entering the spinal cord, one is exiting. Remember we say sensory neuron transmit nerve impulse here, like that, then motor go out one ma. So when they go in and out of the spinal cord, that time I see there's these two tube wherever the neuron will enter and exit from. So these two tube thingies, right, is the dorsal and ventral root. And you can see inside the dorsal root, right, there's this bulging part that contain the cell body of your sensory neuron. Then you can see, right, the cell body of your motor neuron is at the center of your spinal cord, which is called the gray matter. Still remember that? Okay, later we will revise this also. So let's just write the answer for this one first. So next one is still about the cell body, but a bit different already. So now cell body, you will say, is present in the dorsal root ganglion. So it's like a gang of lion there. And this one we will say cell body is, please write this together here. In the gray matter. Next. Now, what else we can say is also the... What already? Okay, this one. See, come back to your spinal cord again. So just now we said they are in these two different tube, two different pipe, right? So this one also is a difference. So one is inside dorsal root, one is inside the ventral root. Okay, so this one we write like that. It enters. So this one will enter the spinal cord because sensory, you touch here already, then it transmit nerve from your receptor into here, right? So you write like that, it enters the spinal cord via the dorsal root. This one will exit spinal cord via ventral root. Okay, so if you remember this one cell body in dorsal root ganglion, then you should remember this law. The entire neuron is in which part of the spinal cord? Okay, then another two, let me give you these two. Now, these two always together one. Now, let me just also mention a bit the structure of the neuron. So neurons, right? They're like human body. Got head, got body, got the butt. So the head is called the dendrite. The body is called the axon. The butt is called the synaptic knob. So neurons, they are one connected to another. Remember in Form 4, I taught you all this? Okay, so they transmit nerve impulse from one to another. It's like one eat already, then he poop into the next person's mouth, then he eat his poop, and so on, and so on, and so on. So, dendrite is the head. But dendrite, in their definition, right, is that it transmits nerve impulse towards the cell body. Meaning to say, this entire part is the dendrite. And axon, the definition is that it transmits nerve impulse away from the cell body. So this entire part is the axon. Then the butt synaptic knob is here lah. Now, if you look at motor neuron, right, since the cell body is at the head here, dendrite will be just like this. Because cell body is right here, ma. After cell body already is your zone. So what am I going to compare here is that the dendrite, this one is long, this one is short. This one is shorter axon. This is longer axon. So you just imagine this person or the cell body at the center. So the head longer, body shorter. So you just remember if this does for sensory neuron cell body in the middle, so the head will be longer. So we say this one has long dendrite. And then this one got short axon. And then this one, terbalik, short dendrite, long axon. Okay. Can compare, not to compare already. Easy. Next. Okay, I skip to C first. Another difference you can say is also the function. Okay, but function, you must depend on how the question asks. If the question asks you to compare structure, you only can mention what I just mentioned here because these are all the difference in terms of the structure. You cannot say function, no? But unless it just asks, compare the difference. They didn't say structure. Then you can include the function. So function, you just have to say, right, they transmit nerve impulse from where to where. So sensory, remember, from receptor to central nervous system means your spinal cord and brain. So the function I write down here is to transmit, this is for Q, sensory neuron, nerve impulse from receptor to central nervous system. And for motor neuron, it's terbalik. It comes from the central nervous system because your brain decided what to do, so the impulse comes from here. But now if you don't go back to the receptor, you go to your effector. Motor neuron controls your muscles, which are called effector. Effector basically help you to carry out response lah. So it goes to effector. So you just write like this one. Okay. Can we put spinal cord instead of CNS? Better to write CNS, central nervous system, because it goes to spinal cord and then brain. So both together. Safer, better a bit lah. Right, then let's come into this question that I skipped here. Draw the direction of impulse. Now, if I look at this diagram, how are you going to know is it going up or down? Okay, for this one, it's quite obvious, right? You know, here's the head, here's the butt. But if I look at this, right, okay, if I don't tell you just now which was the head and butt, right, how am I going to know where is the head, where is the butt? Now, synaptic knot, right, the word knot, you know the word doorknob? Knot is like round, like that, the knot, they twist the knob of the door. So if you look at here, you can see here's like round, fat one. So this one is the synaptic knob. You see dendrite don't have this knot one. So for sensory neuron, you got to look out for the knot, which sometimes could be not obvious in your question lah. Okay, so yeah, synaptic knob is the butt, so definitely head to butt is definitely like this. Okay, next. Done already. We look at this question. Okay, explain the effects of long-term stimulant drug use on human response. Now, it doesn't matter what kind of drug, stimulant, depressant, whatever lah. So long you take drug long-term, what's the long-term effect on human response? Now, okay, don't care what drug it is. So long you take Dada, right? If you take Dada every day, what happened to you? You die. Okay, before you die, don't say die lah. You always say to die, you hear lah. Will brain lose function? Okay, addicted. Okay, number one, yes, you get addicted. Number two, nausea. Okay, you don't get nausea, but nausea is like maybe during that time you get nausea, but long term, right, your brain become chacat. You see those kind of slow reaction, explain withdrawal effect. Yeah, exactly. You all can write this, cannot think properly. So basically, your brain become chacat. You know, you them see look at Penagi Dada and roadside one, right? How many of them are normal? They all like that one, or they talk to themselves, like that, right? So basically, it we will how to say causes mental issues or affect mental health also can. Okay, what else will happen is that you also can say your what's it called? Your brain cannot function properly. Okay, brain cannot function properly. You write this, you have poor coordination and response. Mental retardation cannot lah. Okay, so poor coordination response, right, is what you all tell me just now. The what? Slow response, cannot think properly, slow reaction. Yeah, so it's under this thing. So you say it causes poor coordination and response. Okay, so it will busy disrupt your brain. Your brain cannot think properly lah. Okay, so other than that, your overall health. Okay, now see, this is stimulant drug. Stimulant drug basically stimulate you become more high, more active. So how is by basically increases your heartbeat, your blood pressure, right? So if you every day also like that, your blood pressure will always be high, your heart also always pumping high, so it will cause what we call as cardiovascular diseases. Vascular diseases. And just like any other drug, it will cause addiction. And once you're addicted, right, your body need to take more in order to have the same effect. If you take a little bit, right, like tada rasa. So each time you take, right, you need to inhale more. So basically, you require bigger dosage to have prolonged effect. Can say risk of overdose. Okay, so if you overdose already, what will happen? Basically, you cause this also lah. So yeah, don't say that. Become happy and sad afterwards. Okay, poor cognitive function means this one, no? Cause poor coordination response, because cognitive function means your brain cannot think properly, all those stuff. So all those is classified as this. Become happy and then sad afterward. I know what you're saying, but then don't say that. We just write this few can already. Okay. Then now we do. Later we do more drug question. Later we do the drug. Then now okay, spinal cord first. Okay, just now we just mentioned a bit, right? Spinal cord. There's another drug that numbs the body. That one is another explanation. Numb the body. That one is considered painkiller, stroke depressant drug. Yeah, later we have questions on that also. We'll do that later. But this question, right, is basically just the overall long-term effect of drug on human. So what happened? Yeah, mainly these two mental problem, poor coordination. Yeah, mainly we will say these two lah. Okay, so drug mainly cause this, cause addiction also. These are the easiest one to mention. Now, spinal cord. Okay, if you forget totally spinal cord already, what is it about? This is the cross section of our spinal cord. So spinal cord, like this, cross section, like this. Okay, so we look from the top. This is how it will look like. So it's a one round structure with like a hitch in the center, and then you got two tubes at each side. Okay, these two tubes, we start with these two first, is basically the dorsal root and the ventral root. Dorsal root, ventral root, like we mentioned just now. So you just remember my name. My name is Davin. So dorsal, ventral. And then this is the dorsal root ganglion that we mentioned just now. Now, most of the time, the question, they won't terbalik the sequence. Dorsal always on the top, ventral always on the bottom. If they do terbalik it, you just look out for the bulging part, the dorsal root ganglion. Ganglion is the one that is inside the dorsal root. Then, next, okay, there's two layers here. See, one outer layer, one inner layer here. The outer layer is called the white matter. The inner one is called the gray matter, like we mentioned earlier just now. And then, why is it called gray matter? Because the color literally is darker one. But most of the time you do questions, right, they will either put the same color or sometimes they terbalik purposely. So, how to remember? You just remember, you know the Chinese bao. Bao outside is always white color, then the filling always is dark color one. Same law. Okay, can Then neuron, name them. We've done that in the previous question already lah. So you can see this is obviously your sensory neuron. See, it goes into the spinal cord, the cell body bulging up in the center one. So that is obviously terbalik already. Sensory neuron. This is motor neuron. Then next, the importance of the nervous pathway involved. Okay, now if you look carefully at this diagram, okay, what nervous pathway is this? Okay, I don't want to give you any hint first. You all sincerely tengok. What pathway is this? Okay, detect stimuli and coordinate response is the function of your entire nervous system. Okay, now they're not asking about nervous system punya function. They're asking about nervous pathway. So what pathway if they see? sensory straight away connect to motor. Only got two neurons. So what involve only two neurons one? Yeah, the two neuron one is what first? The reflex. Okay, specifically which reflex is the knee jerk, that one ma, right? So knee jerk, that one, right, is called the reflex arc. Okay, there are two types of reflex arc. One is reflex arc involving two neurons, which is the one they are looking at right now. So that's basically the so-called knee jerk. And the other one is involving three neurons. So three neuron, that one is what's reflex. Is the what reflex action, or when you touch something very hot, that you that one, no. So that one got three neurons. This got the sensory relay motor. This one is sensory motor only. So that one's the knee jerk. Okay? Yeah, so this reflex are involving two neurons. So regardless whether it's this or this, right, they both have similar like effect or function. Means when you touch something, it will automatically pull away. It doesn't use your brain, right? It goes in the spinal cord, then it come back. So what is the importance? Satu kepentingan. Why do we need this? Okay, number one, obviously, yes, to prevent injury. Why? How can this prevent injury? So since I do not use my brain, it definitely will be faster, right? Yes. So number one, we say this first. It provides immediate response. Then you can also say towards harmful stimuli or dangerous stimuli. And if you can react fast when you're exposed to something that's harmful, then probably you get to prevent injuries law, serious injuries law. Okay, so fast, we write this, then of course prevent injuries. So if they show you got three neuron one, which we will do one question later, look something like this one. See, this one touch the hot object one, you got sensory, relay, motor. Okay, then of course some of you ask, teacher, why the knee jerk only got two neuron? Okay, the first answer I will give you is that because this is natural, you're born like that. Okay, this pathway at your knee somehow just only got two. Now, then the more logical response answer is because when, let's say this is your knee, if somebody or something hit your knee punya joint is very vulnerable and also is very important. So if something hit, right, you need to quickly kick away the danger. So when something hit here, right, your response is to automatically faster kick immediately. That's why, right, this pathway, right, they don't insert the relay neuron because tak payah, don't need. And when you got something that is too dangerous or too powerful, just send it back and kick the leg up to protect your knee joint. Okay. So to determine, we look at the number of cell bodies. In a way, yeah, can, but you don't need to look at cell bodies so you can see, right, there's one neuron, two neuron. Just now, that one that I show you, you can see very obvious got three neurons one. See, one, two, three. But of course, you can look at numbers of cell bodies lah, also the same. Can also. Moving on, they asked the same question that we did just now, differences between neuron R and S. So neuron R now is your sensory. So the location of the cell body in your sensory neuron is in the middle. Okay, if you ask location, right, better to say at the spinal cord, because yeah. So this one you must say that like what we wrote just now, present in your dorsal root ganglion. If they want to ask you on the neuron, right, they will say location of cell body on the neuron. If they didn't say on the neuron, then you say where in the cell, in the spinal cord you can be found. No? Okay, so this one also we mentioned already. This one is present in gray matter. Function just now also I got right already, right? Transmit nerve impulse from where to where. Yeah, so this one I just write like this. This is from your receptor to central nervous system. This one central nervous system to effector. Of course, you must write transmit nerve impulse. Then, next question. Mr. T, involved in a road accident and the doctor diagnosed an injury occurred to the neuron S at her knee. So neuron S is this one, your motor neuron. And then they ask how the doctor can make an initial examination to ensure the diagnosis was correct. Okay, now you doctor. Then you realize, hey, why your leg cannot move one? So how to test? Just now only we mentioned, right? Do the knee jerk test, or use the rubber hammer, hit the knee, see whether got move or not. Lor. So first we state the name of the test. So you can say carry out the knee jerk reflex test. Okay, then of course you explain a bit, right? Okay, of course you hit the knee. But more specifically, mention hit the tendon of the knee. So if you were here in Form 4, I got teach you all before, right? If you're physical class also, I could do live demo for you all, right? So let's say here's the chair. Here is the somebody punya knee. If you touch your kneecap here, there's one part that is slightly softer one. That's where the tendon is. You want to knock over there. So you can say knock or hit the tendon at the knee using a rubber hammer. But like say, if you want to do this, right, your leg have to be suspended. That means cannot touch the floor. Means you can sit on your table, sit on somewhere high. Okay, so you gotta be relaxed. You cannot just sit on the chair and lift up your leg. Cannot, like your leg must be relaxed. One, go try yourself. And then just mention if the leg does not jerk forward, means neuron, then neuron S could be damaged. State the effect if this neuron is damaged. So neuron S is motor neuron. So if motor neuron damage, so what motor neuron supposed to do? Control your effector to move. What does effector, why effector need to move? Effector basically carry response, right? If you feel hot, then you control your hand, go and take the aircon remote and on the aircon. So cannot respond, so just say effector unable to carry out a response. Moving on. Next question. Now, explain how this happens and the effect on his body coordination. So let's read the question here first. Mr. K experiencing a health problem caused by lack of secretion of a type of neurotransmitter from the synaptic knob. Now, neurotransmitter, next question also we're going to do about it. Okay, neurotransmitter is basically, that chemical signal between your two neurons and the synapse. Okay, we'll do that question later. So, look at this diagram. See what's his problem. This fellow, okay, basically I act out for you. He walk at times like this one. The typical old people. No strength like that one. So need use tongkat one. So what health problem is this? Show you one more time. You walk like that one. Then he will see you all, he say, hey, young man, what's up? We shake head. Keep on shaking like that one. So what's the problem? Okay, let's name this problem first. This is actually called what health problem? Scoliosis. Your kepala otak lah, scoliosis. This is what okay you eh? This is Parkinson. Okay, you. Parkinson's disease. Okay. So Parkinson is due to lack of a type of neurotransmitter. Okay, let's write the neurotransmitter first, then I explain for you what's Parkinson. So basically you will lack of the neurotransmitter called dopamine. Parkinson disease probably won't have marks for this question because it's just a structure 3 marks. If it's essay 5 marks, then yeah, Parkinson will have marks if it's essay. Okay, so now dopamine, this neurotransmitter, right, got two main functions. Number one, probably you hear before somewhere, dopamine is like a hormone that causes to be, happy, satisfied. Okay, yeah. So like maybe every time you play your game that time, you got dopamine effects, so you feel wow very happy. Like people take drugs and they wow very happy. Okay, so dopamine is a hormone stroke neurotransmitter. Now, other than that, very important also, dopamine actually helps your brain to transmit nerve impulse to your effector. In other words, dopamine helps in controlling muscle, helps in coordination, helps in movement. So without dopamine, right, your brain cannot send signal properly to your muscle. So let's say your brain says now move hand, but your hand cannot move properly because the signal is like cannot send properly. And your brain say do this, but you cannot control. That's why this fellow walk also no strength, walk also shivering like that. Okay. So without dopamine, number one, you can say, so it causes certain neurons in brain to degenerate. Because your brain cannot send signal to each parts properly. And then, most importantly, like I told you just now, also nerve impulse cannot be transmitted to effector properly. So if you cannot send nerve impulse properly, okay, look at this question. The answer is about coordination. So therefore, you can say it causes poor coordination and response. So you cannot coordinate, you cannot respond properly. It also reduces or slows down. You can say brain activity slows down also means you become not responsive, you react slower, you cannot think properly. And then I give you a few more like symptoms. So what are the symptoms of Parkinson? Basically, you have tremoring of hands and legs. So tremoring of hands and legs. You will have weak muscles, means your muscle very weak, like no strength like that. Or muscle weakness also can, huh? Cannot sit down still. What do you mean cannot sit down still? That was ADHD, cannot sit still one. Basically, you walk, you move, also no strength, shivering, like that. Lor. Okay, then we do another one. So later we'll do a few more diseases also. Of course, got Alzheimer and also Parkinson is one of the one they quite like to ask. Okay, we'll finish up this structure question on the next page. Then we'll take a short toilet break. Then, now, synapse. Can this one? Settle? Boleh? Now, next. Based on diagram 7.1, name structures J and K. So, synapse, if you forget what is that, is basically the gap between two neurons. Now, neurons, they transmit nerve impulse in the form of electrical impulse. Okay, but this electrical impulse, right, can only be transmitted in neurons. They cannot pass through the gap of the neurons, which is the synapse. Right? Yeah, that's why your brain can control your body very quickly because you're literally sending electric signal. Your brain say move straight away within 1 second, settle. But between the neurons, right, your electrical impulse needs to be converted to chemical. And how does that occur? Now, number one, you need the help of this J. So who can tell me what is this J? J, how is this mitochondria? Definitely not mitochondria. Bongo synapse is the whole thing. It's the bongo synapse. That's the synaptic. Not inside here. That one is a vesicle. Yes, synaptic vesicle. Inside synaptic vesicle, right, they will secrete this chemical that we mentioned just now. So that fella just now we go say, you know who's that? Neurotransmitter. Synaptic vesicle. So round shaped one is always called vesicle. Yeah, and by the way, I forgot to mention just now, basically this is the end of one neuron. So the end of a neuron is called the synaptic knot. And this is the head of the next neuron. Is basically the dendrite. So they right here receiving neuron. Receiving neuron means the following neuron. But the following neuron you start from the head now, so it's the dendrite of the next neuron. Okay. Now, so I briefly just explained the entire process, like how the nerve impulse is transmitted across the synapse. Now, number one, when electrical impulse reach here, they will diffuse into the synaptic vesicle. Once they're inside the synaptic vesicle, right, you will say synaptic vesicle then releases neurotransmitter. So that's what synaptic vesicle do. It releases neurotransmitter. And what does neurotransmitter do? It basically converts your electrical impulse to electrical again, chemical. Bind to receptor protein. Okay, haven't reached there yet in a moment. Then after that, okay, I continue here. This is 1, this 2, then here number 3. So next, you can then move across the synapse already. So you will say neurotransmitter will diffuse across synapse. And remember, with the aid of what? When they move across the synapse, they need the help of what? Mitochondria means energy. When the electrical impulse is inside the synaptic vesicle, it secretes neurotransmitter. No, it will release the neurotransmitter out lah. They say release, of course you release out, and they release it into the synapse, of course. So you can say release neurotransmitter into the synapse lah. Into the synapse, into here. And then yes, what do they need to jump across this lobang? So this lobang is very big. They need energy. So with the aid of ATP energy. And where does this energy come from? Of course, it comes from mitochondria, which is not shown here. Usually in your diagrams, they will draw mitochondria here. So this mitochondria provide energy, ATP, for the neurotransmitter to move across the synapse. Okay, some of you remember, very good. Protein receptor is the last one right now. So when you jump across, then in Form 5, I tell you, right, the other side, he must have his brother over there to catch him. If not, he will fall down and die. So who's his brother at the other side? This is the receptor protein. So once you reach here already, we will say the neurotransmitter will bind to receptor protein. So this is the final step. Once they bind to the receptor protein already, automatically you become back electrical impulse. Can then so inside the neurotransmitter got chemical impulse. Neurotransmitter is the chemical impulse. Neurotransmitter is the chemical impulse. They are literally chemicals. Okay? Now next, acetaminophen is a painkiller. What is the effect of this? Intake of nerve impulse transmission across the synapse. Now, basically, when you see drugs that end with fen, acetaminophen, what ibuprofen, this is the only two that I know lah. All got fen. They are basically painkillers. But we are not doctors, and we haven't studied. We don't study about medication. We are not pharmacists also. So they will tell you lah what is the name of the drug, what is the type of the drug. They will tell you one. Okay. So painkiller. I read it here somewhere. Painkiller. Okay, later I'll write for you lah. But anyways, painkiller, right? They have similar effect or to alcohol and also this depressant drug. So these two, they basically slow down your nervous system. Now, painkiller, similar effect also. So if you know how to explain painkiller, right, you should also know how to explain these two. Okay, so let's say if now you kena cucuk by knife here, very pain. So how does this painkiller stop you from feeling pain? What does it do? Okay, wow, love you give me answer. Okay, so yeah, got a few types. Number one, yeah, delay transmission of nerve impulse, or we will say it slows down transmission of nerve impulse. But start like this, okay, step by step. First, we say the neurotransmitter. When there's painkiller in your body, right, it will stop the release of neurotransmitter at your pain receptor. Let's say here your receptor here feeling pain. When your pain receptor feels pain, it will send nerve impulse to your brain. That's how you feel pain. It's like pain like that. So the receptor here, right? So when the painkiller is in your body, right, it will prevent the receptor here from releasing neurotransmitter into the synapse. Obviously, this neurotransmitter carries pain signal. So without this neurotransmitter, you'll feel less pain. Does it block the pain receptor? Okay, there are different types of painkiller out there. There are certain painkillers that also block your protein receptor. But for our SPM1 answer, right, you just keep it simple. Means just say it reduce or stop the release of neurotransmitter. Because I see a few schemas, right, not all of it got mentioned the painkiller drug bind and block the receptor protein. Most of the answer will say it reduce or stop the release of neurotransmitter. So we stick to this one better lah. Okay. So number one, you can say it reduce the release of neurotransmitter into synapse. So therefore, you can write like this, less so continue explain on, no neurotransmitter release. Just now neurotransmitter release already, what does it do? It will diffuse across the synapse. So now we just say less neurotransmitter will, neurotransmitter, you can be more specific, carrying pain signal will diffuse across synapse. So therefore, if less of it move across the synapse, the nerve impulse that reach your brain that carry pain signal also will be lesser. So I give you one more point. So therefore, yeah, 2 marks actually enough already, right, like that. But I'll give you one more. So therefore, less, we will say nerve impulse, same, carrying pain signal is transmitted to brain. So first I say it really reduces or it decreases. Also can then less neurotransmitter diffuse across synapse. So this two is the main answer for this question because the question asks about how does it affect transmission of nerve impulse across synapse. Does this happen immediately? Of course, it will take some time lah. Okay, it depends on how strong the painkiller is. At least, half an hour, 15 minutes to half an hour, depending on what kind painkiller drug it is. The snake venom can write, okay, snake venom, that one, later we do one exact trial essay question. Usually for venom, right, we still will say it stop, means langsung tak ada. Because venom more powerful a bit, more deadly a bit. Okay, that one, next, we'll do one essay later. It's about the cobra poison. Yeah, that one later first. Okay, we get to that. Isn't it very misleading to say that the function of neurotransmitter is convert electrical impulse to chemical since the neurotransmitter is the chemical impulse? They okay, because here basically you need to explain what is neurotransmitter. Neurotransmitter is the chemical because they take just now electrical convert to the chemical already ma. Okay, yeah, don't need to overcomplicate, overthink stuff lah. Okay, now next Alzheimer. So just now we did Parkinson. Now Alzheimer. Now Alzheimer, just like Parkinson, right, also lack of a certain type of neurotransmitter. So this neurotransmitter just now was what? Dopamine, right? So substance K is neurotransmitter. For Alzheimer, they were lack of another neurotransmitter, also start with letter A, one called acetylcholine. So just now lack of dopamine, Alzheimer lack of acetylcholine. Now acetylcholine sort of like controls your brain activity, controls your brain to think, connect different parts of your brain together, help signals to be transmitted across your brain. So without it, similar to dopamine, your brain tissues will start to degenerate. So so basically your brain tissues will start to degenerate. As your brain tissue degenerate, then basically your brain will start to shrink. Then you also remember, right? Alzheimer got what symptom? Become forgetful. Yes, like you all right, memory loss. You also so you understand yourself very well. Yeah, so you can say you have a memory loss, or you can say becomes forgetful. So in Form 4, I teach you all before already. Just like you're about to sit for exam. You forget everything that I taught you. Then when it come to exam, you don't know how to write the answer. So you will loses ability to write, speak, and read. Then because exam, you all don't know how to write the answer, then after exam, you all start to emo and say, I feel already lah, very sad lah. Then you all start to behave abnormally. Because people with Alzheimer, right, sometimes they forget like who they are. So they'll act like a totally different person. And then you also can say they will lose sense of direction. That's why a lot of old people wander out their homes and then they go missing. Cognitive function, okay, don't have to write cognitive function so atas punya word lah. Yeah, you can just write this good enough already. Okay, they ask you to explain, right? Like explain Alzheimer. Why lack of acetylcholine causes this? Okay, lack of acetylcholine, you can say that it basically causes shrinkage of brain tissues. Or certain of neurons. Or degenerate also can lah. Degeneration of neurons in brain also can. Why when we given anesthesia during surgery straight away we'll sleep? Yeah? Because anesthesia is very strong lah, the medication, then they give you higher dose also lah. The painkiller you eat usually is very small dosage ma. They maybe give you that one is like what 10 milligram, but this one they give you like maybe 10 grams. And also they just constantly pump into your face. Yeah, that's why it's a stronger dosage and it's also a stronger kind of drug. So straight away lah, you does becoming depressed counts as a symptom? No. Don't have this symptom for Alzheimer. Okay, then we have another disease here. Cannot use snake venom for surgery lah. Snake venom is not just... Snake venom got other side effects also, which could kill you. So no lah, of course. Next, they've written here the disease called multiple sclerosis. Now, this disease, for the past 2 years, right, got a few 2 years, not just last year, 2 years or last 2 years got trials actually asked about this disease, like 2 years in a row. Okay, so what is multiple sclerosis? Is whereby this part of the neuron, like, breaks down, degenerate. You also remember what part of the neuron is this called? Like there's this thing surrounding the axon one. Remember what's that? Like a sausage surrounding it one is called the... Yes, called the myelin sheath. The function of myelin sheath is to act as electrical insulator because the nerve impulse is electrical impulse now. So I want to insulate the electric signal, means I prevent it from coming out, leaking out. If the electric signal leaks out, it will slow down the transmission of nerve impulse. So I want to act as insulator to also then speed up the transmission of nerve impulse. Understand? Okay, so the question now here says one difference between both neurons. I mean, your eyes also can see, right? One, the myelin sheath damage, one is normal ma. So the myelin sheath of multiple sclerosis patient is damaged. Okay, then of course, remember, every time you compare questions, comparing punya question in structure, right? You need to compare both sides. So one damage while one is normal, while the myelin sheath, I just write MS myelin sheath of normal individual is normal. This kind of question cannot draw table. Structure punya difference. If they give you lines, they did give you table, like just now we did this question. Now this question got table ma, so you can use the table lor. If they give you lines, you got to write the sentence. Don't sendiri pandai draw your own table. Unless it's essay, then can. Moving on. 2 symptoms of a patient. Okay, symptom nanti dulu. We do this one first. Then we talk about the symptoms. So let's explain the disease first. So what will happen to the transmission of impulse if the neurons did not have a myelin sheath? Explain your answer. So number one, like I told you already, this thing is to keep the impulse inside so it can flow faster. So people who have multiple sclerosis, right, the transmission of nerve impulse will slow down. So yeah, that's what you're going to say, transmission of nerve impulse slows down. Axon may get injured, cannot lah, because the question one specifically asks you to what happened to transmission of nerve impulse ma. So no. So Then you can explain why. Because myelin sheath act as electrical insulator to speed up transmission of nerve impulse. So therefore, you can say, hence causing poor or slow coordination and response. So actually, this multiple sclerosis is similar to Parkinson because now your nerve impulse cannot transmit properly to your effector. So similar, you might have a bit of tremoring, your muscle become weak, but you don't write tremoring lah, this one. Okay, so for symptoms, right? One of the symptoms you also can say this one, poor coordination response. So you respond slower, you cannot coordinate your hands and feet properly, you cannot walk properly. Other than that, just like Parkinson, you have muscle weakness. Your arms, your legs are weak, you cannot carry heavy stuff. Sometimes you have muscle cramps and spasms. There is what spasms, muscle cramp and spelled like that lah. Okay, meaning that sometimes your muscle just cramp by itself because the nerve impulse, they transmit wrong signal, or you cannot control your hand properly, so you just like contract by itself. And yeah, basically this few muscle weakness, poor coordination response, muscle spasm. Oh, you also can say numbness. Sometimes your leg will become numb also. You also can say causing fatigue also sometimes. Okay, so the three diseases that are done with you, Alzheimer, Parkinson, and this one, multiple sclerosis, is the most common asked one. Okay, then of course, sometimes the question will ask, explain multiple sclerosis, how does it occur and the effects, right? Okay, I haven't explained how does it occur. So basically what caused your myelin sheath to be destroyed, right? It's actually an immune system problem. Means your immune system attack your own myelin sheath. So you can say the immune system basically attacks the myelin sheath, so causing myelin sheath to be damaged, like we mentioned here. And because myelin sheath damaged, then you can continue here. Transmission of nerve impulse slows down because blah 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 blah, then causing poor and slow coordination response. It's an autoimmunity reaction, correct? Means your immune system got problem. Somehow they just thought this fella is an intruder and just attack it. It does happen sometimes. Symptom and effect on individual question punya jawaban can be used. Yeah, can. Usually the effect is the symptom. That's why usually they won't ask together one lah. I mean, they won't ask the same question because you mentioned the effect, then basically that's the symptom. Okay, so you guys feel like taking a break? Yeah, because I also feel like taking a break. So we take a 3 minutes break, not too long. Toilet break lah, don't run away lah. Later we will do essay. So chapter 12 punya essay, all the essay, the two essay questions we do here are trial question. Last year punya trial, so they are quite difficult punya questions. Okay, eat ice cream, good for you. See you in 3 minutes. 3:12 we continue. Now, our last around 50 minutes like that, we'll do two essay questions. Now, starting with this one. Just now, some of you keep on asking already one. The cobra poison. Now, if last year you set for Selangor paper, right? Your form 4 is Selangor paper one, right? Got one question about this one, what cobra snake one. Okay, so it's almost exactly the same. Yes. So, explain how cobra poison can cause paralysis to an individual. So, like I say already, once again, cobra poison, the way you explain it on how does it affect transmission of neurotransmitter across synapse, right, is similar to painkiller that we did just now, similar to also alcohol and the depressant drug. Alcohol basically is a kind of depressant, which we will do one question later. Okay, so like just now, it basically stops or prevents the release of neurotransmitter. Now, for cobra poison, right, it straight away stop. Means got no neurotransmitter. Painkiller is will reduce, decrease only, slow down only. Okay, because now the question say paralysis. Now you langsung cannot move. Your brain cannot send neurotransmitter to your body. Okay, now, of course, right, when we say it stops or prevent or reduce the secretion of neurotransmitter, right, the type of neurotransmitter is different in poison, painkiller, alcohol, and depressants. It's different from one to another, but we don't learn specifically what neurotransmitter control what action. So you don't need to explain too detailed. Understand? Because of that question, ayo, tak dapat A minus. It's okay. We still got SPM, okay? Now I help you, Yeah, because yeah, our Form 4 got a lot of questions. Sometimes this kind of question we didn't manage to go through during Form 4. It's okay. So now I help you. Now, first, look at here the question. Okay, at the same time, I train you how to look at diagrams. Sometimes your answer is right in front of you inside the diagram. See, they will tell you the cobra poison damaged the synaptic vesicle. So meaning there will be no neurotransmitter being released because the synaptic vesicle gone already. So that's the first thing we can say. The cobra's poison inhibits or stops or prevents the synaptic vesicle from releasing neurotransmitter. Grateful KL state paper didn't get question like this. That's why Selangor people pro a bit lor. KL. Okay, anyways, continue. So just now remember we say less neurotransmitter diffuse across synapse. Now, don't write less. When it comes to poison, right, straight away say tada. No. No neurotransmitter will neurotransmitter is diffuse across the synapse. Hey, sorry. Actually, can write one more before this one. You say because they release less neurotransmitter, so less will be released into the synapse first. Yeah. So actually, the schema, right, got this point. I know number 2 and number 3 will sound like repetitive, but got marks, right? So same, I would say no neurotransmitter is released into the synapse. So if they are not released into the synapse, means no neurotransmitter will diffuse across the synapse. And if you look, don't say less. Yeah, so for poison, better don't write less, write no straight away. Okay, they might give you wrong. So just remember that. Then if you look at this diagram, right, what else does this poison do? Because now we write what we're supposed to write is only 3 marks. So I want you to look at the diagram. What else also do you see? What else does the poison do also? Yes, it blocks the receptor protein. Damaged vesicle we mentioned already, done already, that one. So yeah, it blocked the receptor. So meaning to say, your neurotransmitter, even though let's say still got, they cannot bind here. Like here, I lock the door already. It means they still cannot go to the next the next neuron. So that's what we're going to mention now. So I use a different color. So you also can say then no neurotransmitter can bind to the receptor protein at receiving neuron, means at the following neuron. I see the answer, they reject no, they accept less neuron. Um, like I say, it depends on the question. If it's poison, right, we still will say no. If it's alcohol painkiller, then only you say less. So yeah, poison one, we still will say no. Yeah, I checked the answer already. The answer is say no. So better to say tak ada lor, don't have for. Okay. Alcohol and painkiller only we say less. Can. Then therefore, no nerve impulse. So this neurotransmitter is now traveling, of course, to your effector because effector help you to respond. If your effector cannot move, then only got paralysis. So no nerve impulse is transmitted to effector. So therefore, muscle unable to contract to produce response. Don't have to write it blocks. Don't have lah because they already mentioned here block already. They show you here block ma. So you still already say if block already, then what cannot happen? Yeah. So just nice, 6 marks already. It also unable to relax, unable to contract. Contract contract can already lah because relax you don't need nerve impulse on. So yeah, but you can say contract and relax but mainly it's contract. Okay. Contract and relax lah. Can I write both together? Now then the individual was given treatment in the hospital to reduce the effect of the cobra's poison. How the treatment can reduce the symptoms of paralysis experienced by him. Now, I give you a hint. This question is actually from 4 chapter 11. It's totally not related to chapter 12. Whereby for 4 chapter 11, mainly we learn the immune system. So remember or not? What do you need that we learn in chapter 11 that can us treat effects of snake venom, cobra's poison? Wow, I still remember. Okay, T cell, B cell, definitely not. The serum, yeah, the artificial passive immunity. So remember in chapter 4, we learned got the artificial active and artificial passive. Artificial active is you inject vaccine, then it stimulate your body to produce antibody. Now, if you need to use artificial passive, you straight away inject the antibodies that can fight the venom. Okay, because now you want immediate treatment, the poison already in your body. So we're using anti-serum or specifically we call it anti-venom also can. So by the way, this anti-venom, okay, we write down first. He is given anti-serum or anti-venom also can. So what does it has? Which contains specific antibodies to fight the snake or the cobra poison. Then mention lor. Hence, providing him artificial passive immunity. So then you can explain a bit what is artificial passive. So which you can say which provides him immediate but temporary immunity against the cobra poison. So artificial passive is you obtain antibody externally. So there's always passive. So this the antibody come from external source, right? The antibody, once it breaks down, your body cannot produce anymore. That's why you get it immediately, but it only lasts temporary. So if you get anti-serum shot, then jump at snakes, what happens? You probably won't die. Okay. But of course, also it depends lah. How much snake venom do you get? Sometimes the venom is so much to the point whereby your anti-venom cannot counter it, right? So then, of course, where do we get this anti-serum that contains the anti-venom? So basically, they get it from the same snake. So if let's say you have a cobra, some of you might ask if this cobra, right, is bitten by its own kind, will it die or not? The answer is no, because cobra snakes or venomous snakes, right, they have anti-venom against their own venom. Unless the snake that bites the snake is a different species of a venomous snake, then he won't have the anti-venom against it, because every snake has anti-venom towards its own venom. So how do we get this anti-serum? Right? It's basically from the snake itself. So that's why I told you all before, right? If let's say you kena bitten by a venomous snake, right, the first thing you should do is not run away from the snake or kill the snake or suck the blood out from your hand and spit it out, but is to take picture of the snake. So that when you go hospital, you still tell your doctor, I kena bitten by this snake. So the doctor know which anti-venom to still give you. If not, the doctor have to do blood tests. By the time they test out what venom it is, then you're probably dead already. Okay? If I write the effect after receiving the anti-serum, like transmission nerve impulse to recover, no, cannot. They want you to explain the treatment. This is actually a Form 4 Chapter 11 question. Do they have a universal serum? I'm not sure. Next time you study, doctor, you let me know. Lor. I think maybe have lah. Maybe lah. Not sure. Maybe they have it. Okay. Now, H60. That's why I teach you all properly right now. Next time you all become vet, pharmacist, doctor, then you know already. Then you can treat me next time. Okay. Next, compare and contrast the effects of alcohol consumption and taking amphetamine drugs on transmission of nerve impulse. Okay, so alcohol drug is a kind of depressant drug. Actually, here supposed to write amphetamine lah. Amphetamine. Then the first difference you can say is alcohol is depressant. Then alcohol is depressant, amphetamine is stimulant. So that's the first difference you can say. So again, alcohol actually similar like painkiller, similar like the snake poison. Okay, so basically now we say slow down transmission of neurotransmitter and also transmission of nerve impulse. So now from your brain, you also cannot really transmit nerve impulse to your body. That's why people who mabuk, they cannot walk properly, cannot think properly, cannot walk straight. Okay, so number one, similarities first. Okay, come. Regardless what drug do you take, you can say both have effects or both have effects on your transmission transmission of nerve impulse. And drug, alcohol also the same thing. Both also will cause addiction, just like we did earlier. Then drugs, just like we did the first question just now, too much drug also will destroy your brain, right? You damage your brain, cause mental problem, right? So you also can say both causes brain and also liver damage together because drugs are being detoxified by our liver. If too much drugs, your liver will spoil. Liver is like the filter of your body. The filter will become cacat lah. Okay, number one, you can write the type drugs first. Let's say if you write alcohol and amphetamine. So amphetamine is basically meth lah. You know, when you say meth, this one lah, the what cocaine lah. Yeah, it's all under this fella lah. Okay, so alcohol, you can start by saying it's a depressant drug. Okay, I draw like that lah because got one more difference to write here. This is a stimulant drug, like I've written here already. Okay, now let's take this step by step. So stimulant drugs are those kind of drugs whereby people take already, right? They're very happy, they're very high when they're very energetic one. Stimulate them, cause them to be more energetic. So it's basically the opposite of alcohol. So just like painkiller and the poison we did just now, right? This kind of drug, it basically reduces, or we say slow down, or reduce also can, slows down the release of neurotransmitter, or decrease the release or reduce also can lah. This one basically speeds up release of neurotransmitter. Then continue lor. If you got more neurotransmitter, means more will diffuse across synapse. If you slow down, means now less. So just continue only. Now less neurotransmitter diffuse across synapse. This one is more, lebih. Same lah, neurotransmitter diffuse across synapse. Then more neurotransmitter means that your nerve impulse also same because if more neurotransmitter diffuse across here means your nerve impulse overall you transmit more, your brain transmit more impulse to your body, more or less. So basically, next one is almost the same. So now, just now we say less neurotransmitter, so therefore less nerve impulse transmitted to mainly your effector. So this one more. Same thing, a nerve impulse transmitted to effector. So if your effector receive less nerve impulse, you move slower. There's less energy. So you can say less energy produced. This one more energy produced. Other than energy, right, your brain function. fast or slow also. So drunk people, why you're more likely to get into a car accident? That day only got one accident, the fella hit the motorcycle, then the motorcyclist died, that one. So yeah, so by the way, drunk driving, if you drunk driving, you kill someone, you can be charged with murder one. Is that serious one, okay? Yeah, so don't need to say release, slow down, release there. Release of neurotransmitter. I say it, ma? Release. You say it. Okay. Okay, you say ma? Then yeah, because when you're drunk, basically you cannot think properly. Your brain reaction all slow down. Your movement also delay. So basically you can say the brain activity slows down brain activity. So this one, it speeds up your brain activity. Yeah, reaction becomes slow also can. You want to say that one? Okay, so yeah, reaction also can. So reaction becomes slower. This one, reaction becomes faster. Then another thing also that stimulant drug will do earlier, just now I got mentioned, right? It actually increase your heartbeat as well. So you also can say heartbeat rate increases, heartbeat rate decrease. I give you more answers here lah. But the main one, right, okay, it depends on how question asked also, because this question, right, okay, sorry, come out here first. They ask transmission of nerve impulse across synapse. So actually, the most you can write, right, is like until here only. Like these two got nothing to do with transmission of nerve impulse. So again, you're going to see the question. If you just ask you to compare the effect of these two drugs, then yeah, you can write the last two one. But if not, then cannot law. Okay, zoom out. Why you didn't copy? Last question. Ayo, why our class so slow one this class? Okay, come. Next question. Last essay question here. Okay, so just now we have the reflex arc involving two neurons called a knee jerk. Now you got reflex arc involving three neurons. So three neurons one, got the what? Sensory relay motor law. So explain the type of reaction based on diagram 10.1. So basically you can say it is a reflex arc that involves three neurons. And you can say which is an involuntary reaction. Yep, involuntary, very good. That is one of the things you have to say here. And then importance of the response stated in your answer, just like the knee jerk we did earlier just now, right? Immediate response, prevent injuries, same. So importance of knee jerk, importance of reflex, can, same, you can write back the same answer like just now. Okay, so this one I don't do already, same thing, provide immediate response towards harmful stimuli and prevent injuries, prevent serious injuries. Yes, we done this already just now. Exactly the same. Then next, explain how the reaction occurred when he held on to the pen. Okay, just now this question, right, they just want to explain the type of reaction on it. So this is the type, then just 1 mark explanation. Now they want you to explain the pathway. So the reaction that occurred when he held on to pen, so stupid, right? So when I touch something hot, the reaction it caused me to pull away very fast. Okay, explain that one. So number one, pathway, nervous pathway, right? You always start from the stimuli, means your receptor detects the stimuli, and then how does it cause you to respond? So number one, you start like that, when hand touches the hot pen, receptor will feel the heat. So you say, receptor will be... Okay, guys, when receptor detects something, what would it do? So let's say when somebody hit me, the pain signal will be transmitted like that, right? But before I transmit the signal, what does it need to do first? Okay, if we're stimulated, then what does it do next? Before you send impulse, before you send something, you need to generate first. Generate nerve impulse. So before you send message, you need to generate the message first. Say, hey, then only you can send right? Okay, then who will send the impulse is not receptor, it's the sensory neuron. So receptor don't send anything when they just generate. Then your sensory neuron will transmit nerve impulse. So sensory will connect to relay neuron in spinal cord. So no brain involved, I remember. Then so see no brain. So because once your impulse reaches the spinal cord, your spinal cord have a brain on its own. When they detect something that is too dangerous, they will still send it back to your muscle one. So that's how it works lah. But you don't need to explain too much. Once you reach spinal cord, you just okay, from here almost very simple. You just say who passed to who and to who and who. Just relay. Just pass on. So your relay neuron then transmit nerve impulse to motor neuron. Then motor neuron transmit nerve impulse to who? So motor always connect to your effector. So you can say to effector or to muscles at your hand. So muscle at hand then contract, then you pull away from the hot object, and hand is put away from the hot pan. That's how you explain the pathway. Right, next question they ask, so like the drunk driver we mentioned just now, why individuals under influence of alcohol are not allowed to drive? Okay, so explain, no? Like we already did here. What does alcohol do? Alcohol does all of this, right? So why you cannot driving under the influence is against the law because of course it's dangerous lah. Why? Because now your brain activity blur slow already. Your reaction also slow. The car like pam, then only brake too slow already, die already. So that's the reason your brain activity slow, your reaction also slow, everything also slow. How to drive, right? So you can say basically brain activity slows down. Then your reaction also slows down, also causing slower reaction. And your reaction slows, you always can use this word called poor coordination and response. So you coordinate and respond slower also lah. So you also okay, poor cause lead to poor coordination and response. And lastly, you also can say blurred vision. Okay, so when you're under the influence of drug, especially depressant and alcohol, right? Yeah, you see things also blur. You hear things also like not very clear one. Okay, so you can say it also causes blurred vision. So if your vision also poor, your judgment also all will be slower lah. So yeah, you cannot judge things and make decision correctly. So causing poor judgment. So there's a lot of things you can say here lah. So if the question say why cannot drive under influence of alcohol, what does alcohol do to inhibit someone from driving? Your brain slow, reaction slow, coordination and response slow, poor. These three are the main one usually that we keep on mentioning one. Okay, then almost there already. We're almost there, guys. Please don't run away first. Almost already. Almost already. Little bit more, little bit more. Hey, now another comparison question. Now is compare 10.2, 10.3. So we last two page already, 63 and 64, then we done already. So reaction is 10.2 and 10.3. Right. So can you guys tell me 10.3 and 10.2? What is that there to compare? What am I comparing between these two? One is voluntary, voluntary, involuntary. Yes, exactly. Okay, however, guys, the involuntary here is a bit different than the involuntary in your textbook. So in your textbook also got voluntary and involuntary punya comparison. But the involuntary in our textbook, right, is mainly involuntary reactions inside your body, like your organ punya involuntary, like your heartbeat, breathing, peristalsis, blood flow, when you are sleepy, thirsty, that kind. Okay, this involuntary, why is it different than we mentioned just now? Because this involuntary, right, doesn't involve brain and it involves skeletal muscles. The involuntary, like let's say breathing and heartbeat, right, is involving smooth muscles or gland, and it's controlled by a certain part of your brain called the medulla oblongata. So that's why this comparison got a bit different than the one that we usually compare. Okay, so yeah, that's what I do here with you all. Now, number one, regardless voluntary or involuntary, both involves receptor and effector. You need to feel something, then you control effector to response. Next, you also can say both involve neurons. No matter what, you need to use your sensory relay motor neurons to send nerve impulse to control your effector. The one more you can say is neuron both involve transmission of nerve impulse also can. Okay, difference, you already know lor. Involuntary action for 10.2 and 10.3 is a voluntary action. Okay, come on guys. Then got what different? Okay, voluntary involve brain. You need to think, control. Now, speaking to you, I'm using my brain. So obviously this one will say involve brain and also spinal cord. But the involuntary here, like touching hot object, removing it quickly, the reflex action, right, only involve spinal cord. 10.2, this one is 3 neuron, by the way. 10.2. This one is 3 neuron. Only knee jerk is 2 neuron. So both also 3 neurons lah, huh? Okay. So this one involve spinal cord only. Immediate and slow, this one cannot. Okay, come. Your turn, guys. What else that we can compare? So voluntary, you're aware of this thing happening. You do this purposely, or like you control one. So what do we call this? Stimulate different receptor cannot. Controlled by, I know controlled by brain. I already mentioned got brain. So something that you willingly do one. You control, you're aware of it. Controllable, no. Medulla cannot. Medulla I already say cannot because this one no brain ma. So don't mention compare the parts of brain already. I see got correct answer already. Conscious. Hazim, very good. So we will say voluntary produces a conscious, is that how you spell conscious? Conscious response. So it's something that you are well aware of, but involuntary, you say produces unconscious response. Then another one is that your nervous system punya nerves, right, got two types. One you can control one you cannot control one. The one that you cannot control, sorry, the one that you can control is called somatic nervous system. The one that you cannot control is called autonomic nervous system. Okay. Now, if the 10.2 punya involuntary, like I say, is like feeling sleepy, thirsty, heartbeat, breathing, those kind of involuntary, okay, then this one is a bit different already. This one, we will then compare the parts of the brain. So involuntary, that involve like internal organs one, we will say is medulla, controlled by medulla oblongata and hypothalamus. Voluntary specifically is controlled by your cerebral cortex. It's the major part of your brain, the biggest part of your brain. Okay. Now, usually involuntary and voluntary, one more, you can compare the muscles, the effector that they use. So voluntary use skeletal. Involuntary that involve your organs, right? You say controlled by glands and smooth muscle. But this involuntary, right, the reflex response, reflex action, right, also use skeletal muscle like our voluntary. So this involuntary, like I say, is different than the organ punya involuntary. So therefore, the effector involved, right, is actually a similarity here. So both involve skeletal muscle. Understand what I'm trying to say? Because let's say if the involuntary they give you is breathing, breathing is not skeletal muscle already. You say it's smooth muscle and glands. Understand? Okay, final one, just nice. 5 minutes, ngam, then we end already. You can go and sleep. Okay, I know you all want to sleep already. I also want to sleep. This Sunday, sleep on during this time. Slow and fast. This one better don't. Cannot. This one cannot compare like that one. Okay. What lazy, tired one, Ayo. Okay, come 64. The risk of Alzheimer disease is higher among individuals who rarely challenge their mind. So why I always do very tough questions with you? Because I do easy one, you don't challenge your mind. If you don't challenge your mind, you get Alzheimer easily at a younger age. Okay? So who really challenge their mind to study and think critically. That's why, guys, right, every time after holiday, right, I will always say, holiday come back, you're all sure the brain reset already, become a bit more stupid already. Why? Because holiday, you all just do nothing. If you don't use your brain will slowly degenerate. Then when you use the time of the engine, cannot start. So human just like car. If car you didn't start for 1 week, right, then you start, you have the car, cannot start one. Same. Okay, so they ask us to justify this statement. That's why you can see old people, they always do things to keep their brain working. Like if you look at your grandparents and maybe your parents, sometimes if nothing to do, right? What they will do? They will play those kind of what Candy Crush, those kind of what match the block kind of games, because they want to use their brain. Then old people, you see them going to the park, they were like, play mahjong. Then some people will like gamble because they want to do things that use their brain. Okay, is this true? Yes. That's why when you old, right, don't just sit at home do nothing. Do things that use your brain. Even you play game also can, but play game better don't when you're old because sometimes you play game where you rage, then you have heart attack and you die easily. So better don't play those kind of more calming punya game. Don't play like shooting game or Mobile Legend. Play don't know lah, what Pokemon. So number one, okay, we can say this is because you will have lack of mental stimulation. You don't stimulate your brain. Less neurotransmitter, no lah. Okay, we don't need to say lack of neurotransmitter. Okay, what is it? Lack of mental stimulation. So if your brain is not being stimulated, the brain cells punya potential will decrease. Means potentially your brain can do this much one. But now you don't use it, right? The brain now getting weaker and weaker, not really very useful already. And eventually, the brain tissues will start to degenerate. So causing brain. Okay, neurotransmitter also can say one, yes, can actually. Causing brain tissues to degenerate. And then when the brain tissues start to degenerate, means the neurons, you have lesser neurotransmitter. So therefore, less neurotransmitter. You can be more specific also, called acetylcholine is released. Now, other than that, without brain tissues, without neurotransmitter, your connection between neurons in your brain gets weaker. Means they send lesser signal among neurons in your brain already. That's why your brain gets slower and slower and slower until you forget things and so on lah. So therefore, you also can say connection between neurons in brain increases. So hence causing forgetfulness and slow brain activity lor. Get a bit K but lah. That's why we do harder question to challenge our mind so we won't get Alzheimer. Okay. So play games that use your brain more. Play football game. Play the kind of football manager game. You are the coach. Then you think of strategy. Play the kind of strategy game when you old that time. Play mahjong, play chess. Use your brain. Okay. So today it's just until here. Just nice 4 o'clock. Oh my god, so ngam. Okay. So for people who have questions, you can ask me now. People who are not my students, anything you want to ask me, here is my phone number. You can WhatsApp me and ask me questions. Okay. So I will see you guys when I see you guys. So for chapter 13, right, we will actually do this in our normal class next week lah. This week we continue chapter 7 first. Then the following week, we'll do a bit more form 4 lah before our exam. Okay. I got question next Thursday, you do revision, but no, this Thursday we continue chapter 7 first. The following Thursday only we do revision. Okay. Can if I write this okay, no, what is this? Transmission of nerve impulse is less no, don't say that lah. We say less neurotransmitter in brain. Okay. That's it. Bye bye. Bye guys. Good night. Enjoy your weekend. Enjoy your last few hours. See you when I see you. Bye bye. Bye bye. You have training, then you watch recorded video lah. You're my student ma, Hisham, right? Bye bye. Bye bye. Bye bye. Bye bye.